Hello, friends. Welcome back to Learning Nails and Aesthetics. We are on page 84 in the Milady Cosmetology book, Health Sciences, Skin Disorders and Diseases. Don't forget to check out my other videos, the Milady Nails book, as well as their Aesthetics book. Their Foundation book is a companion book to those as well as this one. So definitely watch those videos. Also, keep in mind I am not AI, so mistakes will be made. Also have some fun videos unboxing, trying various nail polishes, different brands and things like that. Temu things like charms, stickers. And if you find something that doesn't particularly interest you, there probably is something that does, so keep watching. We are on learning objective number 4. List and describe common skin inflammations and infections. Skin inflammations and infections. Skin inflammation does not necessarily indicate there is a skin infection, but a skin infection can cause skin inflammation. Skin inflammation. Inflammation is inflammation is a defense mechanism that occurs when something harmful or irritating affects a part of the body. This biological response is intended to remove or eliminate the offending object or organism. While inflammation symptoms can be uncomfortable, they are signs that the body is trying to heal itself. Dermatitis. Dermatitis is a generalized term for an inflammatory skin condition. Various forms include lesions such as eczema, vesicles, or papules. Referral to a medical professional is recommended for appropriate diagnosis. More detailed information is shared in this chapter. Eczema. Eczema is an uncomfortable inflammatory skin disease that is often chronic. It is characterized by moderate to severe inflammation, scaling, and sometimes severe itching. There are several different types of eczema. The most common is atopic eczema, which is a genetic disorder. Eczema is not contagious. Refer all eczema cases to a healthcare provider. Figure 4-7 shows eczema. Skin infection. Infectious skin diseases can be caused by bacteria, fungi, viruses, or parasites. Most skin infections are highly contagious. Bacteria enter the body through a break in the skin. Viral infections are typically transferred through mucous membranes, saliva, or fluid oozing from a sore. They can be mild enough to respond to over-the-counter medications or severe enough to require immediate medical treatment. Conjunctivitis. Conjunctivitis, also known as pink eye, is an eye infection and may be caused by a bacterium or virus, figure 4-8. It can be extremely contagious. Politely reschedule and refer clients with conjunctivitis or even just obviously irritated eyes to a healthcare provider immediately. Impetigo. Impetigo is a contagious bacterial skin infection characterized by weeping lesions, figure 4-9. Staphylococcus bacteria usually cause it. Impetigo typically occurs on the face, especially around the nasal passages, and is most frequently seen in children, although it can manifest at any age. Politely reschedule and refer a client with weeping skin or open facial lesions to a healthcare provider immediately. Herpes simplex 1. Herpes simplex 1 is a recurring viral infection that often presents as a fever blister or cold sore, although many people have no symptoms. Figure 4-10 A and B. It is characterized by the eruption of a single vesicle or a group of vesicles on a red swollen base. The blisters usually appear on the lips, nostrils, or other part of the face, and the sore can last up to 3 weeks. Herpes simplex 2 is caused by the same virus and is designated as type 2 because it occurs below the waist. Herpes simplex is contagious and requires a medical referral. Caution: throw away any products touching infected eyes. Properly clean and disinfect all implements immediately. Check in. Define skin inflammation. Name 2 skin conditions that cause skin inflammation. What causes skin infections? Name 3 infectious skin diseases. Learning objective number 5. Identify skin hypertrophies. Skin hypertrophies. A hypertrophy is an irregular growth of the skin. Many hypertrophies are benign, which means they're harmless. An understanding of common hypertrophies will help you easily recognize them. A keratinoma is an acquired superficial thickened patch of epidermis. A callus is a keratinoma caused by repeated pressure or friction on any part of the skin, especially the hands and feet. Corns are a thickening of the skin that form on pressure areas of the foot. A mole is a small spot or blemish on the skin. Moles range in color from pale tan to brown or bluish black. Some moles are small and flat, resembling freckles. Others are raised and darker in color. Large, dark hairs often occur in moles. Any change in a mole requires medical attention. A skin tag is a small brown or flesh-colored skin outgrowth. Figure 4-11. Skin tags occur most frequently on the neck and chest and can be easily removed by a dermatologist. Psoriasis is a skin disease characterized by red patches, covered with silver-white scales, and is usually found on the scalp, elbows, knees, chest, and lower back. Figure 4-12A-B. Psoriasis is not contagious, but it does require a medical referral. It is treatable, but not curable. Caution: do not treat moles or remove hair from moles. Removing a hair from a mole could irritate or cause a structural change to it. Only a physician should remove a hair from a mole. A verruca, also known as a wart, is a hypertrophy of the papillae and epidermis. 4-13, figure 4-13, it is caused by a virus and is infectious. Verrucas can spread from one location to another, particularly along a scratch in the skin. A dermatologist can remove and reduce the reoccurrence of warts. Check in. List and describe the 5 hypertrophies. Learning objective number 6. List and describe common skin pigmentation changes. Pigment disorders. A person's genetic background influences pigmentation disorders. Hyperpigmentation, overproduction of pigment, and hypopigmentation, lack of pigment, are pigmentation disorders. Various international and external various internal and external factors, such as sun exposure and medications, can, however, cause irregular pigmentation, referred to as dyschromia. There are usually no cure for most pigmentation concerns. For localized situations, you can teach your clients how to cover up or diminish the appearance of hyper and hypopigmentation with camouflage makeup. Refer clients to a dermatologist if they do not have one. You can also educate your clients about broad spectrum sunscreen products to help prevent the progression of certain disorders, as well as the benefits of light exfoliation services. Keep in mind that they said light exfoliation. Aggressive, I'm just adding this little tidbit, aggressive exfoliation of somebody that has pigmentation issues can just make it worse. And I'm sure they'll go into that. I just have these things that pop into my brain sometimes, and I just have to tell you. Hyperpigmentation. Hyperpigmentation appears in several forms. Chloasma is a condition characterized by hyperpigmentation in spots that are not elevated and is generally caused by cumulative sun exposure or aging. It is similar to melasma. Letogen, oh my gosh, what is wrong? Is the technical term for freckles, small yellow to brown spots on skin exposure to sunlight and air. Figure 4-14A-B. They are also commonly referred to as liver spots in adults, older adults, although there is no relationship to the liver. Melasma, also known as the mask of pregnancy, is a type of hormonal hyperpigmentation disorder that appears during pregnancy or with the use of birth control pills. It has an identifiable pattern of solid, fairly symmetrical hyperpigmentation, often on the forehead, cheeks, upper lip, and chin. Figure 4-15, sun exposure can exacerbate the pigmentation of melasma. So a person may have melasma and sun damage. Spots can be helped by exfoliation or can be treated by a dermatologist. A nevus, also known as a birthmark, is a malformation of the skin due to irregular pigmentation or dilated capillaries. Figure 4-16. Stain. A stain is an irregular brown or wine-colored skin discoloration with a circular or irregular shape. Figure 4-17. The permanent color is due to the presence of darker pigment. Stains can be present at birth, or they can appear during aging, after certain diseases, or after the disappearance of a mole, freckles, or age spots. Tan. A tan is a change in skin pigmentation caused by sun or ultraviolet light exposure. Hypopigmentation. Hypopigmentation disorders are seen less commonly than hyperpigmentation disorders. There are various forms. Albinism is a rare genetic condition characterized by the absence of melanin pigment in the body, including in the skin, hair, and eyes. Hair is often white, while the skin is pinkish white. Will not tan, ages prematurely, and is sensitive to light. Figure 4-18. The technical term is congenital hypopigmentation. Leukoderma is a skin disorder characterized by lighter or white irregular patches. Hypopigmentation, caused by a burn, a scar, inflammation, or a congenital disease that destroys the pigment-producing cells. Examples are vitiligo and albinism. Vitiligo is a hereditary condition that causes hypopigmented spots and splotches on the skin that often appear milky white. Recent research suggests that that this disorder is part of an autoimmune disease. Figure 4-19. Skin with vitiligo must be protected from overexposure to the sun. Check in. Name and describe at least 5 skin pigmentation changes. Learning objective number 7. Identify and describe major acne causes and current treatments. Acne and problem skin. Common skin problems that affect clients' appearance, such as acne, can be emotionally devastating. Acne is a skin disease that is thought to be a teenage skin disorder, but can affect people of all ages. Cosmetologists and estheticians can help clients with treatment for minor cases and provide dermatological referrals for more severe acne. Heredity and hormones. A predisposition to acne is due to heredity and hormones. People with acne inherit the tendency to retain cells that gather on the follicle walls, eventually clumping and obstructing the follicle. Hormone levels directly affect the function of the sebaceous glands, increasing or decreasing the amount of sebum on the skin. Retention hyperkeratosis is the hereditary tendency for acne-prone skin to retain dead skin cells in the follicle, forming an obstruction that clogs follicles and exacerbates inflammatory acne lesions such as papules and pustules. Skin oiliness is also hereditary. Overproduction of sebum by the sebaceous glands contributes to acne development by coating the dead skin cell buildup in the follicle with sebum, which hardens due to oxidation. This conglomeration of dead cells and solidified sebum obstructs the follicle. Acne bacteria. P. acne is anaerobic, which means that these bacteria cannot survive in the presence of oxygen. When the follicles are obstructed, oxygen is blocked from the bottom of the follicle, allowing acne bacteria to multiply. Acne bacteria's main food source are fatty acids, which are easily obtained with the abundance of sebum in the follicle. These bacteria flourish in the ideal environment, which has plenty of food, the sebum, for the bacteria and is void of oxygen. The bacteria multiply, causing inflammation and swelling in the follicle, and eventually rupture the follicle wall. Then the immune system is alerted, causing blood to rush to the ruptured follicle, carrying white blood cells to fight the bacteria. Blood surrounds and engulfs the follicle, which is what causes the redness and pimples. An acne papule is an inflammatory acne lesion resulting from this wall rupture and infusion of blood. A pustule forms from the papule when enough white blood cells accumulate to form pus, which is primarily composed of dead white blood cells. Cosmetologists and estheticians cannot treat acne pustules. Grades of acne. Acne is graded on a scale of 1 to 4. Table 4-3. Grade 1 acne is mild and usually treated with over-the-counter skincare products, whereas Grade 4 acne has progressed to consistent breakouts and deep cysts that require medical intervention. Activity. Skincare product search. Go into a pharmacy or research online to find 3 skincare products for acne grades 1 through 4. How is each used? Grades of acne. Grade 1, minor breakouts, mostly open comedones, some closed comedones, and a few papules. Grade 2, mainly closed comedones, more open comedones, and occasional papules and pustules. Grade 3, red and inflamed, mini-comedones, papules, and pustules. Grade 4. Cystic acne. Cysts with comedones, papules, pustules, and inflammation. Scar formation from tissue damage is common. Acne treatment. Mild forms of acne can be treated without a medical referral. The basics of mild acne treatment involve daily use of gentle cleansers formulated for a specific skin type. Foamy, rinse-off products remove dirt, debris, and excess oil from the skin. Harsh cleaners can make the skin too dry, causing sebaceous glands to generate more sebum, creating an even bigger problem. Toners may be helpful for clients with excessive oily skin. Use or leave on follicle exfoliants that help remove cell buildup from the follicles and allow oxygen to penetrate the follicles, killing the bacteria. Commonly used ingredients in these products are alpha hydroxy acid, salicylic acid, and benzoyl peroxide. Benzoyl peroxide can be especially effective since it helps shed cellular debris and kill the acne bacteria. Use of mild exfoliation treatments that gently slough dead skin cells, such as those formulated with salicylic acid. Avoidance of skincare and cosmetic products containing large amounts of fatty materials and oils, which can clog follicles. Use makeup and skincare products that are non-comedogenic, which means the product is designed and proven not to clog follicles. Use of a light moisturizer to keep skin balanced and reduce the risk of excess sebum production. Check in. What are the two major causes of acne? And how should they be addressed? I hope this was helpful to you. Don't forget to comment, like, share, and subscribe. Let me know you're there. Comment just a hello, or let me know where you're listening from. An emoji, something simple. You don't have to write a dissertation in the comments. And check out my other videos. I appreciate you watching. Have a great day. Thanks. Bye.